Hi, I'm CT editor Rich Sampson, and welcome to the latest edition of Digital CT Magazine, the changing face of non-emergency medical transportation. I'm joined here with our editor-in-chief, Scott Bogren, and I'll talk to you a little bit about kind of the broad themes that are going on in this issue, where we really look at the changing dynamics in NEMT service, and then kind of give you a rundown of the various features and profiles in the edition. So, Scott, maybe you want to talk a little bit about the broad picture about what we're thinking in this issue.
Thanks, Rich. Yeah, I think what we really and we took our time with this edition. It's probably about 2-3 weeks after we wanted to get this thing out the door, but we did that with a real strategic focus. Some reports and research started to emerge that we wanted to make sure were part of this edition. And, let me just talk about some of the big themes that I think you'll see across this important edition of the magazine. One is NEMT is very complicated. It's not this simple service that maybe it once was, although many of us would argue that it never was simple. It's always been complicated. It's only getting more complicated. It requires, and you'll see in the research pieces, there's jargon and real healthcare-related discussion, and how transit and transportation fits into that is changing, and that's another big theme that we hit on in this edition is how swiftly things are changing based on technology, policy like the Affordable Care Act, service delivery methods and modes when it comes to things like TNCs and private automobiles, volunteers, all the different ways that we serve the non-emergency medical transportation field are really have been upended. And the two research pieces, there are three pieces. If you don't read anything else in this edition, and it's a full edition, Dale has an editorial piece that leads directly into two pieces of research. One done by our former executive director, David Raphael, and Steve Borders from Grand Valley State University. The other one comes from us from the University of Illinois, Chicago, and a look at Illini Care. And what these two things do is they prove that dealing with HMOs, insurance agencies, in Oregon, they're called coordinated care organizations, is really the future. And the data, particularly that David and Steve present, that actually looks at utilization rates in the expanded Medicaid population for 2 counties, is really a first. It's the first time we've had that data and been able to analyze exactly, not by conjecture, but exactly how are people utilizing the system. So there's a lot of really good stuff in this edition, but honestly, it's more difficult, it's more challenging, and it's going to get more so. And so that puts the onus on you, the folks in the field that are providing these trips. And I'm going to toss it now back to Rich so he can tell you a little bit about more of what's in this edition and why we think there's so much important information for you. So, Rich, why don't you take it from there?
Yeah, and as Scott said, we want to give you tools to respond to some of these changing dynamics. In addition to the research pieces that Scott talked about with regarding to the Affordable Care Act, we get into some specific details at the state level, at the local level, on how different areas are responding to these changing dynamics. We give you 2 different state profiles in Michigan and Kentucky of how they've went and responded to brokerages and created a new system for transit to kind of lead the way instead of just responding to whatever the state selects. So we'd encourage you to take a look at those. At a local level, we talk about Prairie Hills Transit's relationship with the regional medical system in western South Dakota and how they were able to create a spin-off nonprofit to work directly for some of the NEMT trips that the regional medical system was kicking out. We look at two demonstration projects, actually, one in Illinois on emergency EMS providers and transit systems working together to kind of peel off the less emergent trips right to transit and doing that in a formalized way. Then the other demonstration project we're looking at, Scott wrote about, is the more national Medicaid demonstration on scheduled repetitive ambulance trips and what's transit's role in kind of lessening the burden on the ambulance community on that. So take a look at those pieces. We also have some kind of forward-looking aspects on veterans in NEMT, what care needs to be provided for them, and how does the VA system and all its requirements kind of get interwoven with that. Chris Eilinger from our staff wrote that piece. And then we take a look at how in New York, and not most communities aren't New York, but most communities do have TNC providers these days, is how Lyft is helping seniors get to doctor's appointments and kind of really taking a close look into NEMT and transportation network company service. So that's another interesting avenue we're traveling down. So there's a lot here to consider, and there isn't just one way to respond to these shifting dynamics, and it really depends on what works best for your state, your community. And this isn't a conversation that we, by any means, intend to stop with this issue. Stay tuned the rest of this year and going forward. We're going to have a whole wave of innovative approaches that will help you keep responding and adapting instead of just being locked into one model for NEMT service.
Well, and I to kind of finish off the video here, Rich is exactly right. There are innumerable opportunities for community and public transportation providers to engage with the NEMT markets. And the issues that you hear about and we write about and that are ones that you likely are thinking about, helping with hospital discharge, reducing emergency room, reducing ambulance trips, all really speak to one key issue, and that is value. Outcomes and value. The new healthcare model in the United States is based on giving that first level of care to patients to avoid more expensive issues down the road. And the ability to get there to those trips is where you come in. And there is no one way. There are going to be multiple ways to do this, but it's all going to be judged through the optics of good patient outcomes and the lowest cost possible. If you can be focused on those two issues, the rest of these things and the ideas you see in the magazine, I think, all provide you with hopefully inspiration to look at things in a little bit of a different way. So thanks for taking a look at this edition. We're real happy with it. We think it's really chock full of both the kind of narrative and data and analytics that we think are important and need to be brought forward into the discussion today on non-emergency medical transportation. So we look forward to hearing from you, how you respond to the edition. And again, we will be back soon with another edition of Digital CT Magazine.
Thanks.